Hey there, welcome back to the Complicated Kids podcast. I'm your host, Gabriele Nicolet, toddler whisperer, speech therapist, and parent coach. And today I have Lisa Kays. Lisa, welcome.
Hello, welcome.
So tell the good people a little bit about who you are and what you do, and then we're going to launch right into the discussion.
Sure. So I am a clinical social worker. I have a private practice in DC, Maryland, and Virginia. Well, also Oregon and New Jersey, but that's where serving mostly adults, a lot of parents, but mostly adults with kind of typical depression, anxiety, addiction. I run a lot of groups. I do a lot of work around relationships and relationship dynamics. And I am the parent of two neurodivergent kiddos living in a very neurospicy house we're all discovering.
It is a process of self-discovery. We recently did a workshop for other social work and mental health professionals. And you have a unique term that you have come up with. Tell us what it's called, please.
Yes, it is called diagnosing backwards, and I'm open to edits. I just made it up.
So, what do you mean by diagnosing backwards? What is it? Why is it important? Why should we do it?
So I came up with the term, and basically what it means is, as a therapist, often the therapist gets into therapy the mom, sometimes the dad, but for the purposes of this, I'm probably going to refer to the mom. We'll know it means the parent or the grown-up raising the child. And, you'll get a mom presenting with a lot of anxiety, a lot of concerns about their child's development. The attachment between the child and the mom might be off. The mom is not enjoying parenting the way that one might expect, all kinds of things. But so diagnosing backwards is what I actually learned from a parent I was working with, and it's assessing the child via the therapy with the parent. And it is allowing yourself to go into a diagnostic path by interviewing the parent, which therapists are really discouraged from doing. I think socially it comes across as like taboo, impolite, risky. But I did it largely because I had a friend who actually helped me get my oldest son into the right OT because he was doing the whole running around the birthday party, lots of sensory stuff. I had no idea. I've been a social worker for 10 years. I had no idea what was going on. And she said, I don't want to make you mad. I don't want to upset you, but I'm wondering if you should get a sensory eval for him. And then off we went on our journey, right? But had she not said that to me, I think years could have been lost. And she said it to me thinking I may be risking our friendship. So therapists are in that position. And then I had a dad come in saying, my kid's lazy. He doesn't like to read. He doesn't like school. And I went, yeah, hold up, because I don't believe in lazy as a word and as a concept. And I make that very clear with anyone I'm treating. And anyway, I talked to him. I asked all the questions. I'm not a learning specialist. I don't, but I kind of asked around. And I said, I think you may want to, I didn't know what I was talking about, but I said, I think he may need an assessment for a learning disability. Kid was diagnosed with dyslexia, put in a different school, now is doing great, reads great. I'm still working with those parents, but that was when I was like, oh, we have to, as clinicians, think past the parent. And we have to apply our clinical knowledge of many, many, disorders, learning disorders, sensory disorders, autism, ADHD, sometimes to the kid, because it is a myth that parents they're in a system. It's not individual.
And this is why I love social workers more than anybody else in the whole world because social workers are trained in systems. Like they understand this. But there's so many layers of what you're describing here, right? Because when a parent goes to a therapist, ostensibly they're going to deal with their own emotions and their own responses to situations. And the therapist, usually, I've been in therapy, I'm not a mental health counselor, but right, is meant to be like a sounding board and like provide strategies and insight. And the insight part is where I want to pause. Because if the therapist cannot spot possible neurodivergence in the atmosphere of where the parent is living, then that therapist is actually giving the parent really, really bad advice. Do
It's
you
a
want to talk a little bit about that?
misdiagnosis. So when we did, and it helped me, I actually hadn't conceptualized it that way till we gave the presentation and I put together my slides and I was like, we're misdiagnosing. If we are not, if we're looking at mom and going, wow, you're really anxious and you're wanting to take your kid to every developmental person on, calm down. Like, what's, and we're misdiagnosing and we're, not Irvin Yalom, Dr. Gabor Mate's latest book, The Myth of Normal, talks about how one of the greatest issues that we have in our society is that we have downplayed and removed the value of parental instinct.
Mm,
Have undermined parental instincts. And I was like, whoa. Because if you have somebody sitting in your office saying, I think there's something like something isn't working. My kid doesn't respond when I say their name. My kid doesn't seem to want to interact with me. Right. My kid is having tantrums every 5 minutes. I am like up here. Right. That's not an anxiety. Just mom might be anxious, mom might be depressed, but it's not because of an organic issue, right? There's stuff happening, and then you put in the social pressure that we know. Well, why can't you get your kid to? Then we put in the parenting industrial complex and the social pressure, and we have a really tough soup if we are not understanding what's actually going on and what that mom is experiencing.
yeah.
And I think then you factor in that you have the pediatrician saying, oh, let's wait and see. This is like within the right. And mom kind of starts to get, or the parents are almost getting gaslit. Like, oh, and they're at home going, yeah, this kid is not acting at the doctor's office like this, like I am experienced, because we know that they do that.
Yeah.
And where the school is like, what, they're fine. And you're like, I am experienced. And it's not, it's a misdiagnosis.
Yeah. And that is really, I mean, number one, you're going to potentially traumatize your client. Number two, you're going to just be giving general bad advice that's not going to work, right? So we might be tempted to like give strategies. And many, many of the parents that I see for coaching who come to our Raising Orchid Kids classes with Jen Dreyer and me, when they come, they have tried everything else. Like read all the parenting books, they've talked to all of their friends, they've talked to multiple doctors, and people are saying things like they'll grow out of it, don't worry about it, they're just stubborn, they're lazy, they're all of these things. I particularly love your example of the kid who doesn't like to read. Shout out, I mean, I say this, I don't know, I feel like once a week. If a child doesn't like to do something, there is a reason. And it's not because they just don't like it. It's like human brains are wired for new experiences because that's how we learn things about life on planet Earth. Like that's literally how you have to be in your body. You have to look at the black and white contrast figures when you're an infant, and you have to look at somebody's face in order to see who they are and read their eyes and their facial expressions so that you can learn how to talk, so that you can learn how to read and do all these things. You go on the swings when you're a toddler. As soon as a parent says to me, my toddler doesn't like the swings, my back is up. I'm wondering what's going on. And the slide. That's right. That's right. Because when we don't like something, it means we're in protection against it. And when we're in protection against it, it means that something about our nervous system is perceiving that as a threat. And that means we've got some kind of something happening. Like, let's take a closer look. And so I love what you're saying about like parents are being gaslit by people who are like, don't worry about it. Right? No, let's go back to that feeling of like, I think something might be wrong here.
And let's just be curious. And because it comes up as this like, oh, there's something, and I think that makes everyone anxious, right? There's something wrong. And I am kind of like, can we just be like, if we assume nobody's lazy, like you're saying, we assume it's like we have to be curious. Why is the kid not responding when mom calls their name, other than they're a bad kid who doesn't listen, right? Like, why is the kid, like my kids, cursing like a sailor at 2 or 3, right? Like, because they like the sounds of the words. It's horrible. It's bad luck, the words, but like there is a why, and it is not the kid is bad, and it is not, the kid is lazy. Like my oldest son, when he got to kindergarten and it was virtual, so we were doing it all at home, I would open the book and he fled the room. Like he ran. I was like, that's not even just not liking reading. That is like, and his teacher kept saying, oh no, he's just not motivated. And I was like, he's fleeing the room. He had vision issues. He had like vision, his eyes were seeing double. It was confusing. It's all fine now. But like, that's not, oh, he's just being difficult. I mean, he's fleeing something.
Yeah, it's really interesting to see kind of what types of responses we come up with as adults to describe children's behaviors. And I think this is apropos of like this therapist parent dynamic, right? Where the parent is bringing examples like you would of like, my child runs away in fear, distress, whatever, when I open a book, right? And rather than jumping to judgment about like, well, clearly you didn't read to him when he was 3 months old, or like, right, like clearly he's got some major cognitive issues, or like, right, any of it, which maybe he does have also, by the way, or not. It's like, can we pause to go beyond? Mona Delahook has a great book called Beyond Behaviors. Can we pause to wonder why we are seeing the tip of an iceberg right in front of us? Can we wonder what's underneath that? Right? Can we wonder what the driving force is? Because we're not just like popping off all the time for no reason. Like we've all got motivation for our behaviors. So what is the reason behind it?
Right. And nobody wants to be fleeing, right? Something not stressful. And I think I mean, thank God I feel like I got into you and Jen's course early enough to start really getting, because what will happen to a parent, I think, let's say you didn't read, I did read to my kids, but let's say I didn't, because I also had kids that when I did try to sing, they would cover my mouth because I don't, who knows, maybe I'm a bad singer. I took lessons. She said I'm not. But like you could have a kid that you didn't read to because they freaked out because you didn't say the same word ever, right? And so that experience became really stressful. Then you get a mom who's secretly thinking, "Oh my God, he's not reading and it's my fault because I didn't read to him." And then you get this shames, right? And there's no one going, "Wait, wait, wait. I need to look at this whole picture." You are a well-intended good parent, because the messages and the blame that people put on parents, and it makes people afraid to say like, this is what's going on. I did stop reading to him at 1 because it was like a nightmare, right? Or whatever you stopped doing or did do, because you're just trying to piece together
Yeah.
something, and all the parenting books are telling you the wrong thing for your child.
Yes. And so if you're a parent who's in therapy and your therapist is minimizing your concerns, number one, or making you feel like you do have things to answer for by suggesting unhelpful behavior strategies, either stay and educate them or get out. So that's number one. But for therapists also who are dealing with parents who have a heightened level of stress, who are reporting concerns about their children, what advice do you have for those? I mean, we told them straight at the workshop, but
Well, for the therapist, you
yeah, for the
mean?
therapist.
I think what I was saying to the therapist was, and this is dicey, right? Because you get a spectrum. You get a spectrum of the parent who's like, I don't want to hear anything. I don't want to hear anything about that my kid there has a diagnosis. I don't want to hear a word. You get that parent, to the parent who's like, oh my God, tell me everything. What is going on? Like, please, I'll listen to anything, right? The one that was more me. And so it's delicate, but what I really want therapists to hear is you are a clinical diagnostician. You have been trained. And we were trained badly in neurodivergence. So maybe go get some more training. And there's really good training now led by people who have these diagnoses from their lived experience. But trust to be curious about, if you've got a parent who seems way over anxious, hates parenting, wishes they never had kids, is afraid to go to the park because of how their kids act. Let's not assume the parent has social anxiety, right? Widen the lens and ask questions about the child. What is this kid do, right? Because I think as therapists, especially if you treat adults, we think, oh, that's not my lane. That's not what I'm supposed to do. And I'll say to people, they'll ask me stuff about their kids, and I'll say, look, I'm not a kid person, but this is what Gabrielle and Jen say. So this is what I think, but I think we might want to ask an expert. I think you might want to, but to empower yourself to look at the whole system. What does your partner say? Are you guys fighting a lot about the parenting? What are the fights actually about? Like, and listening to, because oftentimes both parents are right. Like there's a little bit of truth in both. And so it's really letting yourself be curious and then becoming aware of the resources for parents where you don't even have to use the scary word. You don't have to say, hey, I think your kid might be autistic. You don't have to say, hey, I mean, you might with a parent that's more open, or you might just say, I think maybe it's time, let's do a sensory eval and let's see how that comes back, right? Or you kind of ease them in whatever way the door is open. But to let yourself educate people, understand that everyone's in a system, understand the parental stress and the messages that these moms are receiving about like the oh my God, the food. I mean, we could do a whole thing about the food. But when you have moms that are like, I just don't feel like what I'm hearing is the right thing for my kid, but it also feels like bad parenting to not do it, like to give my kid the bagel, he's just going to live on bagels, right? And you're like, maybe today we might just live on bagels if they're eating. And so, but it's really letting yourself use your diagnostic lens and remember that our job is to refer to people with more expertise. And and also we do psychoeducation. So educating parents about, it's not the 80s. If your kid gets an autism or an ADHD diagnosis, they're not going to be thrown in a corner, right? There's IEPs. Like I really like to tell people your kid is going to get what they need.
Yeah.
And whatever, way we use our therapy way of kind of meeting someone where they are. But I don't want clinicians to back away anymore from like, oh, I'm just going to treat mom's anxiety because I don't know what's going on here. It is our business.
Right. Right. Well, particularly, right, if mom's anxiety is being caused in part by the behavior. I love what you said about like, I don't like to go to the park because of what they might do. Right. And it's like, as a therapist or as a third party who's hearing that, you might think, oh, your kid's really off the rails, or you might get curious. And this is always, the same principles applied across situations, right? The more curious we can be about why people do what they do, the more and better answers we will get. Because if we go in being like, oh, that kid's off the rails, there must be something wrong with her, there must be something wrong with them, the kid, there must be something wrong with whatever, like, and then we're blocking ourselves, we're blocking everybody. Versus, oh, I wonder what's going on there. I wonder why. What is it about going to the park that's so disturbing? Now, we still might like launch into some unhelpful suggestions, but it is also possible that parent tries those and reports back and says that didn't work. Now we know we've got to refer. Please refer.
I love a lot of experiments. And like I have a podcast called What If Nothing's Wrong with You? Because I'm always like, there's nothing wrong with anybody.
Yeah.
We might have an interaction that's rough because you got a neurotypical mom and you got a neurodivergent kiddo and they are just like locking heads but it's like we have to just be curious and kind of look at, and I love to give experience and be like, what if you just tried this? And I just want to, I'm not invested in whether I'm right or wrong. I just want to see what happens. Like report back. I don't know,
Yeah.
but you're kind of experimenting to see.
Yeah.
And I feel like, and I think it's different because I do have the spidey sense because, when you've had two neurodivergent kids that are both different brands, but I do think you can develop kind of a sense of like, oh, what this parent is describing is not typical development with like a pretty good air of confidence, and no, you don't have to have a PhD in autism or ADHD
Right.
to know like, oh, this doesn't sound like what my other parents are describing. Most kids seem to go to bed before 11 p.m. Huh, okay.
And most kids sleep through the night. This is what we say a lot on this podcast, which is child development, when it's going well, looks effortless.
Yeah.
And parenting, actually, most of the time, it can be challenging, but it's not like tear your hair out, life altering challenging, unless you've got some competing, either neurospiciness or some other kind of diagnosis. Like unless there's something else going on. But it's not until something else is going on that we realize how complex of a thing child development is, matrescence is, becoming a parent, anyway, that whole process, particularly for women, right, which is very physical, and we never stop and talk about that. Um, like if you've given birth to a child, like literally your whole system has changed. And so it's all very complicated, right? And we don't really know it's complicated until something's going wrong. And then we're like, well, why is this so complicated? Well, because it always was. We just didn't really see it. And so then again, like just pulling the threads and being like, okay, well, is it this kind of complicated? Let's see. No? Okay, maybe another kind of complicated. Let's pull on this one again, right? And so we can be doing that with both parent and child, because guess what? Sometimes parents are neurodivergent too, right?
Usually.
Sometimes they do have their own diagnoses.
Yeah. Usually you get a kid, usually you're gonna get somebody above the kid, maybe both people. I'm on a bit of a journey, who knows? But you're often looking at a system that's gonna it's a lot of learning in a very compact amount of time, right? And I think for therapists to know like this journey, it like, and I think too, when I think about it now, like if you've got the client that maybe you saw for like, a good 1 to 5 years before they had a baby, and they were pretty chill and cool and whatever, and then they have the kid and all of a sudden they're like demon mom, or like super stressed out or controlling, or like I gotta lock this, and you're like, wait a minute, this is that's another clue, because like when you say parenting is usually effortless, that makes me laugh. Like that is hilarious to me. I don't know, I'm like, what are you, since infancy, right? I'm like, I'm all, and that's what these moms feel like. They're like and what the mom internalizes it as is like, I'm just doing something wrong. All these moms know what to do and I'm bad at this. That's how we internalize it. And so that's why with my new moms, I mean, I drill down. I'm like, are you sure it's going okay? How is it really? Are we sure? Like, tell me more. Like, because they'll hide that because they think it's their failure. And it's like, no, you have a kid that might be hard to soothe, that might be hard to regulate, that might, I would
Ooh,
look at their parents and be like, how are they sitting at lunch with their, I don't understand.
listen, I want you to say that part again, because diagnosing postpartum depression is one thing. Looking at an infant who is hard to soothe will cause postpartum depression, right? Because that kid doesn't sleep, that kid doesn't stop crying, that kid takes a long time to eat and isn't consoled by a full stomach, probably has reflux, doesn't nurse well sometimes. And then, yeah, then everybody else is sitting at lunch with their sweet little babies who nurse and drop off to sleep. And you're like, I must be a terrible parent.
Like I must walk around this room 15 times. I can't talk to anyone. So now mom is getting lonely because all the other moms are sitting here chit-chatting and I'm over here dealing with like this child that won't stop moving, or I have to move the stroller or whatever. So mom is getting increasingly isolated, increasingly lonely. And at nap time, instead of sleeping, she's on Google going, what in the heck? Right? Like there is this incremental stress cycle that starts. And then I think too, let's say you have a neurodivergent mom or dad. I mean, I don't want to pretend that the dads are not involved here. It's just easier because I'm a mom, but neurodivergent people struggle with transitions. the transition into parenthood affects them too. So you got a baby trying to transition into life. You got maybe an undiagnosed neurodivergent parent having their first, like, kind of their own meltdown. Because, I mean, it can be a lot to parse out. And we are just not trained. We're like, oh, yeah, it's really hard in the beginning. It's, postpartum. And we need to be kind of thinking, like, is there more here?
Yeah.
Because I used to look at other moms and be like, what is happening? Why?
Yeah, why is my life look nothing like theirs? And this is not about, I want to be really clear. This is not about like comparing necessarily. This is about a degree of separation, an order of magnitude in an experience that is above and beyond, that requires more. Okay. Those are the folks we're talking about here. Yes, people have postpartum. I had a postpartum depression that was triggered by my labor and delivery. First time I didn't know it for 9 months. That was super fun. Second time I knew it within 2 weeks. That was a lot more fun, right? So there can be that, but then there's also like, compounded stress where parent and child aren't a good fit. And then parent is stressed because child is stressed, and that's feeding each other. And if we don't have a therapist who is recognizing that, now the therapist is in on the deal too. So yeah, this is like, again, not about comparing oneself to anybody else, but it is about highlighting like, this is significant. It's not insignificant. Let's not whitewash it, or kind of explain it away with just maternal stress. Yeah.
It's a transition. It's like we need to really piece it out and look at it. And another thing I use too, this is a new one since, because we all grow and learn as our kids grow up. But I noticed that in my parents with neurotypically developing kids, when their kid turns like their youngest child turns about 3 to 5, they sort of go into the like, oh, I'm living life now a little more, right? I'm through the toddler thing. There's this shift where they're like, I've taken up some of my hobbies again. Me and my husband are traveling again a little. There's this like little, and I would have people say to me like, oh, you're gonna love it. Around 3 or 4, you can go on vacation again, and you're gonna feel like you're on vacation. And I'm hitting 3 or 4, going, when will that be? When is that arriving? Because that's another thing I look for, is when that doesn't happen, when that kid is turning like 3, 4, 5, it's another curiosity point for me, because it's often just later with our little neurodivergent friends. It takes a lot longer. And so parents are getting tired.
Yeah. Yeah. Yes. Um, we could talk all day. And this is a big, big topic. A couple key takeaways. If it seems like it's harder than it should be, it probably is. And we should ask why. Do you want to like,
And I think also, I'm all about like, I'm happy to be wrong if your kid is typical, and I think, whatever. Because I think as communities, we also need to like we need to be able to say to our friends, like, not, but have you just, I swear to God, if anyone says to me, have you just anymore, as friends, like my friends saying, I think maybe, your kiddo, it's like, thank God, I really want to normalize us educating each other, our sisters, our sister-in-laws, our, daughters, our whoever, our friends, and saying like, hey, this seems to be really hard for you. I'm not sure this is you. What if we assumed it, like, because people are not always in therapy, and we kind of got to do this. If you have a friend who seems like they're a little more stressed out, or if you're at your friend's house and like the baby will not calm down, and you're like, this is not what it's like with my niece, or maybe, I don't know if you want to go saying, hey, I wonder if your kid's neurodivergent, but you might want to say like, have you talked to anybody about this? Or, like, I think just not putting it on the mom, like, what are you not doing?
yeah.
Instead of saying like, this seems tricky. This seems like a tricky thing.
Yeah. And those I wonder statements can be very, very helpful, right? I wonder if this is harder than it's supposed to be. I wonder if you've talked to the pediatrician about this. We use this with kids all the time at Raising Organ Kids, right? I wonder statements are not questions that need to be answered. They are just little thoughts in the air that you can either choose to take or leave. And so if you are a friend and you want to come at it from a very non-judgmental, more curious kind of, but not asking a direct question, I wonder. I wonder, I wonder if you're okay. I wonder if this is going the way you think it should. Um, Lisa Kays, if people want to work with you, if they're in New Jersey, Oregon, or the DMV, how do they find you?
My website is lisakays.com is probably the easiest way. And I have a podcast called What If Nothing's Wrong with You, where we talk a lot about just depathologizing, nor like therapy and real human talk for humans.
Nice. Love it. Take a listen. And thank you so much for being here today. This was a treat.
Yeah, thanks for having me.